And we will have some more time to discuss after the last keynote, where we have a small panel session. But now it's time to ask our next presenters, sorry, wrong row, next presenters. And it's Dr. Annalisa Trama, the head of evaluative epidemiology unit in the National Cancer Institute Milan. And her colleague also, Eugenio Geta, senior researcher and software architect from the University of Polytechnic in Madrid. And you will talk about transforming healthcare with digital innovation. And please. And Annalisa, Dr. Trama is the principal investigator of the several national and international projects on secondary use of health data. And you also are the founder of the key international collaboration on rare cancers, the Rare Care and the Rare Care Net Asia. And you will talk now a little bit about how we could use data in real world. Thank you. Oh, I take the banana, so sorry.
Yeah, but I hope I will get one after my talk. So basically, often when I discuss with colleagues of mine, he always reminds me that Martin Luther King didn't say, I have a vision, I have a strategy, I have a plan. He said, I have a dream. And I think this is the dream that we are living within our project IDEA4RC, where we are really, dreaming to have data that can really change the life of rare cancer patients. And by the way, I think it's not by chance that childhood cancers being rare cancers was preceding me in this keynote speech. We really need data, and of course, as it has been already said, we want to make data available in the most suitable and by law, respecting privacy, but ensuring that these data will reach the patient. We want data because behind data there is an increasing of knowledge and understanding. And we are living the moment through which we can really move from the current situation through innovation, through digitalization. We can really make this dream become real. Why rare cancers? Well, because I think that being rare, often these patients are discriminated against only because of their rarity. So we need to pool data to make discovery and to improve the life of this patient. Just to give you an idea about how rare one of these cancers can be, because there are more than 200 different types of rare cancers. So heterogeneity, of course, increases the difficulties in making research. Epithelioid hemangiosarcoma, okay, you can have 1 or 2 cases in a country, in a small country like you, if you are lucky. So you can imagine why, for this type of tumors, you really need networking. I know that here you are already working, across Nordic countries, but here we really need to go beyond national or, transnational. And that's why we have an opportunity in here. We have European Reference Network, launched in 2017. There is one for childhood cancers. Huracan is the one on rare adult solid cancers. So 80% of these rare cancers. Of course, these networks are an opportunity that we really think we should leverage. It's an opportunity also because we don't only need to pull data together. It's an opportunity to decrease inequalities in terms of quality of care and in terms of survivors across countries. But of course, if we work in network, just to give you an idea, Huracan encompasses more than 100 different healthcare organizations across 20 member states. You can immediately envisioning, okay, across these countries and the complexity of the different healthcare organizations, how difficult when we go to data can be putting the data together in terms of interoperability, in terms of data quality, in terms of governance, in terms of sustainability, in terms of motivation, in terms of governance, in terms of legal basis, in terms of legal framework, just to give you an idea. And that's the reason why, with our project IDEA4RC, we decided to bet on challenges. And the challenges we will present today, and Eugenio Geta will provide the tentative IT solution, the innovative solution that we are thinking are basically four. One related to the heterogeneity of the data, the one related to the findability, the data security, and the data access. I think these topics are really, aligned with what Axel introduced earlier on. Let's start from the first challenge, heterogeneity, and I told you, only Huracan span across 20 member states, more than 100 healthcare provider organizations. Here we are trying to reuse data, to use data available in electronic health records for doing research. Now, if you think, even I think within the Nordic countries, how many different electronic health records exist in terms of formats, in terms of organizations that are managing and updating them. How much heterogeneous this EHR can be, because they need to serve clinicians. EHR, we thought for the primary use of data. We cannot force EHR to be seen as a structure type of data set. These are made for clinicians, so they clearly are based on text. And we are in Europe, so text is basically made and written in the local country language. So we are dealing with an heterogeneity, not only in formats, not only technical, but also in language. And of course, you can imagine that the quality is completely different. Again, EHR have to serve a clinician during their clinical practice. It's on us to leverage the information included to be used for research. The second challenge is, of course, related to the findability and understanding of the data. I mean, if you think about the FAIR principle, some of you, especially the youngest, may be quite aware about the FAIR principle, and especially the F, the findability of the data. I can tell you that many of my colleagues, and I work at the National Cancer Institute in Milan, one of the major research centers on cancers in Italy and in Europe, they don't really have idea the data already exists. Especially if you are interested in data not coming from already, big organization, biobank that have been formed, and organized themselves in the last years. If you're talking about data from hospitals, for any type of hospitals, because if we want to be unbiased, we need the data of each single patient. Well, I can tell you that these data are not available, and the clinician, the user, our researchers are not so aware about, how much data are already available and can be reused. And the other problem is that when a user, when a researcher or a clinician is interested, well, the current standard we are all working in are very general type of standards. The first question a researcher or a clinician will ask about the data available is, but are these data useful for my research question? If I want to better understand the prognostic factors for a sarcoma of the limb, well, I need information about the stage, about the age, about the dimension, about the treatment. How do I find this type of details information in the available metadata? Well, I can tell you that it's not actually there. So do I have to go across all the 100 different hospitals, try to understand which information they have? Can you imagine to go through, first of all, trying to understand which data is available, in which format, and maybe, in different language? Because again, not everybody is prepared, not different healthcare organizations are preparing for addressing the problem of pulling data. It has been also already stressed, the point of the security. And I mean, we are really living an exciting moment, Innovation is bringing us a lots of opportunity, but also a lots of threats that cannot be addressed as we used to do. Threats are not coming anymore only from outside, but also from inside. So it is clear that the level of solution, the level of technical solution is becoming always more and more important, always more and more complex. Also the requirement that the General Data Protection Regulation, for example, is demanding, the HES, is reaching a complexity that is not available across the healthcare provider, across all the different future data providers. And I mean, these security issues, the responsibility that data holders have in terms of ensuring the privacy of the individuals is also, in a certain sense, increasing the barrier, unfortunately, to data sharing. Whereas GDPR was intended to really ensure the sharing of data in the best way forward. Unfortunately, all the requirements are really increasing barriers. So there is always more and more the idea to control the data up, to the last user. And that's why, it's becoming a challenge to find solutions to really share data without, putting in risk the privacy, but also, ensuring that this data will be used again to benefit the patient, because this is the end why we are trying to use and pull together the data. And the last challenge is, of course, related to the data access. We need data now. Despite the HTS is envisioning the first implementation in 4 years, and we are happy about it, we need data now. We need data yesterday. So far, when we talk about data access, you have to go through different access procedures that might change across countries, that might change across institutions. Procedures are completely different, are not, interoperable. You don't know exactly to whom you need to address your request. And of course, there is always, regardless of the thousands of papers that you have to fill in, regardless of the thousands of meetings that you might have with legal or with clinician asking you about, cybersecurity and things like this. I mean, there will be always, that sense in the back of the mind, but then what's happened? How can I make sure that despite all these, paperwork, the data will be used only, for that reason? So these are the challenges that IDEA4RC is basically trying to address. I will try, hopefully, to launch a video if I will manage to.
More than 5 million European citizens live with a rare cancer. These diseases are not common, yet all types of rare cancers, taken together, make 25% of all cancer diagnoses in Europe. Still, there's much we don't know about them. Highly specialized clinical centers in Europe routinely collect health data to provide the best care for patients affected by these diseases. Such data are a precious resource for scientific research. Each center, though, receives very few patients with the same type of rare tumor. Therefore, their data alone are not sufficient to obtain new insights on the disease course, the effectiveness of treatments, or factors influencing prognosis. However, it is not easy to use data from multiple centers together. They are collected and organized in ways that vary from one center to another. Moreover, accessibility is limited for privacy reasons. This is where the EU-funded project IDEA4RC comes into play. This project aims to develop a specific software. It will allow researchers to easily and safely analyze relevant data collected by multiple clinical centers. Engineers are developing tools to harmonize the data across the centers. In addition, computer scientists, with the help of clinicians, are training AI algorithms to extract information also from texts and categorize them in a database. The database will include an extensive list of variables specifically selected for researchers to use. But what about the protection of patients' personal data? Each center will host a capsule, which is like a digital vault where their own health data will be stored. As an additional layer of data protection, every researcher interested in analyzing the data will need to submit a request. A dedicated software component will handle the request, asking the authorization to every center involved. After receiving the permit, researchers will be able to run analysis over the data using the IDEA4RC infrastructure and tools. They will only have access to the results of their analysis. while the raw data will never leave the clinical centre's vaults. In this way, researchers will gather new evidence on rare cancers while keeping patients' privacy safe. Researchers and professionals with a wide range of expertise from 25 institutions spread across Europe are turning the IDEA4RC project into reality. They are working together to make data access easier and get a better understanding of rare cancers. The ultimate goal is to improve the quality of care of all European citizens living with these diseases.
It's my pleasure now to give the floor to Eugenio Geta to present you the technical details of our solution.
Hello, I'm Eugenio Geta, and I am the technical manager of the IDEA4RC project. Okay, now I will give you some information on how we use artificial intelligence in the IDEA4RC project. Okay, we have 4 main areas where we are using AI. First one is for medical entity extraction. The other area is for natural language processing query builder. Then we have conversational AI for IDEA4RC application, and finally the federated AI approach. Okay, let's see now what we mean with NLP for medical entity extraction. Okay, what is the scenario in IDEA4RC? Most of all data, more than 80% of data of some of our centers are in unstructured formats. That it means that is free text. Okay, so we have different languages such as Italian, Spanish, Swedish, and others. We have the problem that we can have semantic ambiguity when this text is not structured. And what we have to do basically is we start from this text in Spanish, and we have to try to identify patient, condition, treatment, and so on. For instance, in this case, Ignazio of 8 years old is the patient. Then we have the condition. We have some procedures that are explained in this text, medication, encounters, and observation. Okay, so what we want is an AI system that is able to catch this information for us, because this will speed up and will allow us to get as more additional data as possible. Because as we are talking about rare disease, what we don't want is to lose any data. Okay, we want to take advantage even of irrelevant data. We want to try to catch everything. Okay, so this is more or less what we expect to do with this kind of system. What we have done until now in IDEA4RC, we have used some state-of-art AI technology, like a large language model, to do that. And we have made this solution as scalable as possible, because we are not linked to a specific model, but we are evaluating the most important one. At the moment, we have tested YAMA3, QWQ, and DeepSeek, and we have seen that we have more or less the same result. But this approach does not prevent that if a new model will be published, we can use it. Okay, and in order to speed up this process, we have also developed an annotator tool that help clinicians that are working with us to annotate some text for specific training and customization of this solution. Starting from this, we have also think about how we can make easiest the life for clinicians when they want to search data and they have no technical knowledge on this. So we have developed another solution that is able to be used directly by clinicians that hide the complexity of structured standard like COM, OpenFire, and provide easy access to the most common query that can be done on this data. Okay, so in this case, what we have? We have a query that is in free text. The system needs to understand what are the entity that need to be used for the query and build something strange like this for us. Okay? So this is what artificial intelligence can do for us in this context. The other, what are the key innovations that we have for NLP Query Builder? That is an application that is designed with and for the clinician of our centers. Okay, it is based on the state-of-art algorithm because it is using the natural entity, the NLP entity recognition algorithm that I presented before, and we have customized this algorithm to, instead of only detect the medical entity, also to organize the query that are described by free text. Okay, so as we are using a state-of-art LLM model for NERR, we are also using the same algorithm for this case. A part of that, we have designed a special data model for this that add some redundancy that make easiest the life to the clinician to build this query. Okay, so this is more or less the main innovation you can find in IDEA4RC solution for natural language processing query builder. This is how it looks like. If you see in the user interface, the system automatically identify the concept that then are validated by AI, and then it build the SQL technical code behind. Another kind of application that we build with AI in IDEA4RC are the classical chatbot that help a user while he's using a web platform. Okay, something like an assistant. Okay, so in our case, we have defined a conversational AI system that help the user while he is using the IDEA4RC ecosystem. Okay, this is more or less how it looks like. It is a special case of a large language model that is customized and trained on the specific functionality that the IDEA4RC platform is providing to the final users. Okay, so it's like, you can imagine it like a guide that is not textual, but you can ask in the user interface of the chat what you can do with the platform, and it will provide you the necessary information to understand what is inside the user interface, how you can build, for instance, a query on the data, how you can perform a data access application, and so on. Also in this case, what we are using also open source state-of-art large language model technology. We have trained this model specifically on the documentation of the IDEA4RC platform, and we are also working on make these assistants available to take action on the platform on behalf of the user in order to perform some not critical operation. Okay, and this is more or less what we are doing with the new technological wave of artificial intelligence, that is the one of large language model. But we are also working on how to solve the problem of privacy, that is something that is very critical for us, and we want to try to maintain privacy, but without losing any information. So we do not want anonymization, pseudo-anonymization. We want to try to use all the data set that is available in the center without lost any data. Okay, how we do that? We are, sorry, this is how the AI assistant look like. But how we do that? We use federated AI. As Annalisa explained it before, and as you have seen previously in the video, we have built in every center something that we have called capsules. But what are these capsules? They are environment, technical IT environment, where data are only processed locally. Okay, so imagine that every one of you has its own data in his house, and what is able to do this capsule is to manipulate, calculate, process those data without giving this data to anyone outside your house. Okay, this is mainly the concept. So you always maintain sovereignty on your data. You never share your data. The only thing that you need to share in this context is the result of the computation. Okay, so what is the scenario that we have in IDEA4RC? We have 11 centers that manage very sensible data on rare cancer, that are interested in common research, but they want to lose the control and the sovereignty on their data. Okay, so to do that, we have also built a common data model, as Annalisa explained before, because to perform a federated analysis, we need to speak the same language. So if data are stored differently in each center, we cannot do that. So what we have done is define a common logical model that then we have traduced, translated, and mapped in a different standard. We have applied OMOP and FIRE because nowadays they are the most used standard in healthcare in Europe. Okay, FIRE is supposing to be adopted in primary use of data, and OMOP is more for secondary use. And then we have developed an approach based on federated learning. That is basically what I said you before. Just to give you a very simple idea on how federated learning works, let's try to calculate an average with the federated learning. So what we do, we go capsule by capsule, and we calculate the local average. Okay, once we have calculated the local average for each center, we take the partial average and we made the aggregation, and we get the final result without sharing any information of patient of the centers. Okay, and this is how we use federated learning to get the maximum potential of the data inside the center that are part of IDEA4RC project, without trying to lose any important information that can be hidden inside the data. This is the architecture of the system, and this is more or less the innovation that we have in our approach. We are leveraging with different healthcare standards. As I said before, we are using Botfire and OMOP. We are also providing what we call it an algorithm store that is a safe site where federated algorithms are stored, and these federated algorithms are previously evaluated to be sure that they grant privacy, because we cannot execute any kind of code inside the capsule. Okay, and we have also integrated all this stuff with zero trust architecture that are nowadays the most advanced security architecture that are able to grant a lot of security features. And basically, and we have also implemented an external governance platform for the access control over the data, okay? And basically, this is in a nutshell what we have done on AI with AI inside our project. Thank you very much for your attention.
So thank you. Sorry, I think we have time for some questions.
Okay.
And so it's a very, very ambitious project, I understand. And one question that I would like to ask both of you is, how do you all the hospitals that are, I thought you said 25 hospitals or something.
11.
Was it hard to convince them to be part of this federated network, or?
I go first? Yes. It is not that it was hard to convince them. It was hard to make everybody understand what this federated network means. Because as you were saying, you need to co-create certain process. And this is exactly the example where co-creation was needed, and where only, the possibility to work with high-level technical person, legal, and very important also the role, of the clinicians, because we really need to make sure that our solution was compliant with the security, okay, of the hospitals, to make the legal understand, okay, what this federated learning would meant. And of course, this was, to this extent, the push of the needs, okay, of the clinicians working in the hospital, of course, was very hard. This was for the coordination point of view. I don't know if technically, Eugenio, you have
technical was a problem of digital transformation, because most of center was unaware of the possibility of new technology and was not familiar with the new technology. So we are still fighting with some center to explain them how zero trust work and how it's secure, because they basically do not use. They are still 10 years ago on this technical stuff. So major difficulties to promote with them the digital transformation on federated approach for privacy preserving and so on. This was the most difficult thing to do.
And how do you, because in your presentation you talked about this is the project is about for researchers. Is that correct? Or is it also for clinicians to use then in real world, or?
Is for any type of user. That's why sometimes I would say researchers. Is for secondary use of data for research. Actually, our envision stakeholders include also competent authority that might be interested. Patients are an envision stakeholder. So all those that needs data to answer, okay, either some hypotheses or wants to have a better understanding, they are all basically allowed in our dream. Then, of course, as I was explaining, now we are discussing with each hospital that provided basically data to what extent, for example, a patient can access the data, or you need at least an organization, to access, whether it's an individual level or which is the leverage, whether private, industry can access. But ideally, okay, the tool is for all those that needs to use the data for research, for the reuse of data.
Perfect. Thank you so much. And you will have a workshop during this week on that subject, isn't that correct?
Yes, you are all welcome on Wednesday morning. There will be more the technical track where there will be not only Eugenio, but all our partners presenting the details of solution, while in the afternoon on Wednesday, there will be more a general discussion, including, of course, the legal solution we provided. Thank you for recalling it.
Small gift for a carry-on.
Thank you
So much.
Thank you.
Thank you.
Thank you.